Hi, this is Justin in partnership with Rolling Out Health IQ, and I'm here with Cindy Milligan to talk about your heart. Cindy, can you give us a little background on who you are? So glad to have you here today.
Thank you for having me, Justin. Yes, I am Cindy Milligan. I am a cardiac nurse practitioner at Piedmont Atlanta in Buckhead, and I work on the advanced heart failure transplant team.
So, based on what you're seeing in the community, and shout out to you for the work that you're doing as a steward, as a healer, for the community. What are some of the things that you've noticed, some trends in heart health of African Americans? What are some of your concerns? How have things changed over time, for better or for worse?
I think one of the biggest concerns that I have, or that I've seen the constant through the years that I've been in healthcare, is the consistency of going to the doctor on a regular basis to have your physical and just keeping that yearly update of health and not coming in when people are extremely sick and we're finding out all these things at one time and it's a little too late. The blood pressure's been high, their kidneys are, they're in renal failure, or they're coming in with a stroke or they're coming in with a heart attack. And, the first question we ask is, when is the last time you've been to the doctor? And they can't tell you. And so that is, and that's, kind of resonating among a lot of populations, but for the most part, that has been one of the biggest things that I've seen in our community for a long time. Or they have medications that they're prescribed and they don't take them.
And so, do you think this is systemic? Do you think it's trauma? Do you think it's past perceptions? Do you think it's misconceptions? And how deep does those rabbit hole goes? How is it affecting, year over year, people coming in? And is there a solve, right? Have you seen any significant success in being able to recognize those stigmas, those hurdles? To get more people treated and living healthier lives.
I think it definitely has some stigma with it. I can remember, my grandparents, they didn't like going to the doctor. My dad hated going to the doctor. So it's just that, mistrust of providers, especially when they don't look like us. They are nervous, they're afraid, and then it's like, they just want to give us a lot of pills. And then, Google now is everyone's friend. So they read one side effect and they take the pill once and they think they're having that side effect. So I think there's a lot of things of just mistrust in healthcare professionals and the system, that they're trying to harm us as a community. So it stems back from things that have happened in the past. And so, our community is just kind of looking like there's a lot of uneasiness about, well, why do I need to go? Or if they do go, with the medications that they give, they may take it once and it's like, well, I don't think I need it. Or if their blood pressure gets better, they're like, well, I'm cured. I don't need to take it. But that's the whole reason that you're on it. So your blood pressure can improve. And so it's just understanding once it is improved, you have to keep taking it. So it's not going to elevate again and cause those long-term issues. So I think a lot of education, and I love to do that with my patients and the families, of just explaining these disease processes, because if they're diabetic, if they have high blood pressure, those things and high cholesterol, we call that the trifecta. That's the trifecta that is going to lead to heart disease. It's going to lead to stroke. So if we don't get those three things under control, and if you have a family history of those three things, you are at such a high risk. And if you have a family history of those things, your risk factors are just through the roof. So it's super important to just have those conversations and just help people understand how important it is. If you have any of those diagnoses and a family history, your risk factor just goes way up for heart disease and stroke.
So for those who are taking medication now, obviously they know what they need to do, stigma or not, it's one of those things about quality of life. But for the younger generations that may have risk indicators based on, family members who may have had some heart issues. I mean, what are some basic things they can do to just get ahead of it or at least be aware so that they can mitigate that fear?
Yes. Getting your yearly physical, making sure your labs are done, checking your, there's your kidney function, your cholesterol levels, eating healthy, exercising, and just moving. It doesn't have to be strenuous exercise. Walking 3 to 4 times a week, 20 minutes a day. Just making sure a healthy lifestyle of eating well and moving. We have a very sedentary lifestyle now, of work, and then people sitting at home. Once they get home, we don't go out and walk, and we're not outside anymore like we used to. The children are not, and definitely adults, we're not. We don't get out like we used to when we were younger. And that's just how the world has shifted. So I think just being more proactive and making sure that we have physicals yearly, and especially if there's a predisposition of family history of any of those things that I just mentioned, of diabetes, cholesterol, and high blood pressure, just being cognizant of that, because there's no age limit to where these things can affect people. There's people in their 20s with high blood pressure. There's people in their 20s and 30s with high cholesterol and diabetes. There's type 1 diabetics that are kids. So we just have to be really mindful that age does not mean anything anymore, that all these things can affect all of us at any age.
We also know that in the older generations, in our older age groups, the men are afraid to go to the doctor,
Yes,
right?
yes,
So what would you say to the men and women? Because what is it? The women that are the ones that are, making sure their husbands or their partners going to the hospital or going to the doctor.
yes,
Men live longer when they're married. That's
that's so
one
true.
of those studies. What would you say to those groups? Any advice, any words of encouragement, recommendation to keep them going, keep them healthy for their heart?
So one thing that I always, question, and this is something that, especially in our community and others, a lot of the medications for high blood pressure, they affect a man's libido. So that is a question that I always ask. Is this medication, the reason you stopped it, does it affect you in the bedroom? And that is some people may get embarrassed, and they just, they don't want to talk about it. But that is one of the number one reasons that a lot of men stop taking their blood pressure medicine, and they come in and they have strokes and they have heart attacks, and their blood pressures are 200s, 220s, 250s over, those 130 numbers, because they start having erectile dysfunction from their blood pressure medication. But if that's the case, there's other things that we can use to help control their blood pressure so they don't have that. So I have very candid conversations with my patients, just so they know that there's other things that we can give them so they don't have that side effect.
When we talk about fried food, sodium, right?
Mhm.
Excess
Yes,
sodium, and sugar, right? When we start thinking about high blood pressure, because again, the silent killer, we want to illuminate, we want to put a
yes.
call to action to folks. Um, is a balanced diet or at least going to war with excess salt? Is it something that can make an effect on high blood pressure, lower your numbers combined, obviously, with medication and or diet and or exercise in this case too? So walking.
Absolutely. It definitely makes a big difference. Shaking that extra salt after your food is cooked, it has a big effect. We talk about low sodium diets all the time with our patients, or the Mediterranean diet, not frying your foods, baking your foods. It has a huge impact, because that in fact is a direct correlation with the cholesterol levels. So if you're eating fried foods, fast foods, it definitely has a huge impact, and it can make a big difference if you start baking your foods, or oven pan frying your foods, and not all the greasy residue and frying the foods. It absolutely has a huge impact of just changing the eating habits. It can definitely direct blood pressure and cholesterol levels tremendously.
Cindy, thank you so much for your time and for your stewardship in healing the community. We really appreciate you joining us today.
Thank you so much, Justin.